May is Domestic and Family Violence Prevention Month, and of course we're in the midst of all the COVID-19 chaos, and with the onset of regulations and concerns around COVID-19, people have kind of retreated to their homes. I'm Trina McClellan, and this morning I'm just going to have a look at what that might mean. Indeed, many people are staying in isolation for various reasons, but that doesn't necessarily mean that they're safe. That's because isolation can present additional challenges for those who've been experiencing domestic and family violence. One of my colleagues at Women's Health Queensland is Ange Swift, a counsellor who's spent many years supporting women experiencing violence at the hand of their partners or family members. Ange, perhaps we can start with the scope of the work you do at Women's Health Queensland.
Hi, I am an accredited mental health social worker, and my role here is as a counsellor, and I have a focus on working with women in assisting in recovery from domestic violence and gendered violence.
It's been widely reported that domestic and family violence incidents have risen during the COVID-19 period, yet Queensland Police are suggesting that the number of applications for DVOs or domestic violence orders have tapered slightly. You've been speaking to women in such situations. What are they telling you?
Women are telling me that even without living with partners who are potentially leading them to feeling unsafe, that they are feeling that the restrictions themselves cause significant feelings of as though they are in a violent relationship. We're feeling that women are probably seeking less help because of the isolation, because their partner may be working from home and they may not be able to access help or make a telephone call privately. So there may be a tapering. However, it doesn't necessarily mean that there is less need for DVOs. I think it's the ability to access them has become very difficult.
Yes. So what advice would you give a woman who felt unsafe in her home?
Firstly, if someone is feeling immediately unsafe, first suggestion is to call 000, or alternatively you can call 1800 811 811 and speak to someone at DV Connect. DV Connect is a service that can help you look at ways of accessing safety immediately. They can look at different alternatives to emergency housing.
Leaving a violent relationship or a violent household can be a tricky thing for lots of reasons. Are there steps a woman can take to increase her safety?
It's very difficult safety planning, and we have to work with an individual based on their specific needs and their situation. The woman's safety can decrease immediately after leaving the relationship. So one of the things that we need to do is take all of the situation into account. Somewhere like 1-800-RESPECT, which is 1-800-737-732, will work with women ongoingly to help them prepare for an exit plan, or they will refer you to a local, refer a woman to a local domestic violence service who might be able to sit down and plan with you. And I think it's about doing it safely and planning with the resources that you have, other people, so you can do it in the way that protects you most at the most risky times, which is just post-leaving.
Okay. So one recent Women's Health Queensland survey conducted among 100 women who had or were experiencing domestic or family violence was quite eye-opening for me. Almost half of those respondents said they had not reached out for help because of feelings of shame. What would you say to someone who might be listening today if they felt they couldn't speak about their circumstances?
Well, shame is really common with women seeking out support when they're experiencing domestic violence. And one of the reasons is a lot of friends or family members may not understand the subtleties and complexities of violence. So women tend to avoid talking to others. So what I usually tell someone is, to talk to the professionals. There's a lot of support networks out there that will provide assistance, whether it's your local community centre, your GP, like I said before, DV Connect, 1-800-RESPECT, lines that are going to provide you with the information that you need to help to make a decision, but also just to validate those feelings that you're experiencing. But if you have a friend who you think may have been through it before, or someone who understands these sorts of things, you can see if a friend will listen or help or provide support. But if you're not finding that is out there, then there are services available.
Including Women's Health Queensland.
Yes, of course. Including Women's Health Queensland, we provide counselling when women become safe and stable. We provide counselling to support them to rebuild lives and deal with any trauma they've experienced.
So how can women experiencing or in fear of domestic violence, or family violence indeed, go about making a safety plan, especially if the perpetrator or the perpetrators are with them pretty much 24/7?
Well, and I guess this is pretty difficult. If you're in an unsafe situation, it's about connecting you with a domestic violence service local to your area and looking and addressing all the issues that might come up for you. And it's about finding resources and using the systems that we have in place, which is not always a DVO. Often it might be safe housing, safe and secure housing, which the locations are highly secret and cannot be disclosed, or there is having safety numbers, knowing what triggers are. But I think the most important thing is seeking out help, and when you're unsure, giving one of our telephone numbers a call. We can speak to people here at Women's Health Queensland, and we can connect you with the service that you need.
So what about if you were a friend or a neighbour of someone who you suspect is experiencing domestic or family violence?
I think the most important thing to do if you suspect someone is experiencing family violence, because like we said before, there is a lot of shame attached to coming forward. I think it's really important not to judge. I think it's really important not to blame. People might feel shame even if you're not judging and blaming, because they may not be ready to be open about that yet themselves. I think it's about being there and keep giving those people opportunities to talk about it should they wish to. If we try and push people to talk about it before they're ready, what tends to happen is that people will shut down, and it might make them feel like they have to defend the relationship. So I think it really is about not judging and not judging people's choices, because sometimes people stay in relationships because just after leaving is really unsafe. It's not a situation of if someone's violent, just leave. It's about planning that safely and very specifically in ways that keeps you safe.
I understand that it's common for people that are in a domestic violence situation to perhaps try leaving multiple times before they actually eventually stay left.
Well, yeah, absolutely, that's it, because there are various different types of violence. Not all violence is physical. A lot of it is financial, and if a woman leaves and then finds herself in much worse financial situation because of leaving, then the situation becomes much more difficult, and they could be at further risk by leaving. Look, I've heard on average between 4 and 7 times someone may leave a violent relationship.
And we shouldn't judge them for doing that.
No, and I think it's really important to acknowledge there are a plethora of reasons for that, and they're very valid reasons, and that we shouldn't judge because it's a very complex situation. I think especially knowing that someone is going to be more risk post-separation, then of course we can't judge. Someone might come back to a relationship for their own safety. Unfortunately, sometimes that's a safer situation, but it's common to leave multiple times, and there are so many reasons that happens, and we just need to be, I think, working in the area of domestic violence, there's a lot of patience required to get someone to the point where they feel confident enough to leave, that their support and skills and emotions and self-esteem is built up enough to leave, because domestic violence is aimed at destroying your emotional safety as well as your physical safety. So when you don't have emotional safety, it's very difficult to make decisions. So if you're wanting to support someone who's in one of these situations, I think it's about considering making emotional safety a priority for you to provide them in the relationship that you might have with them.
Thanks very much for your time today, Ange. Before we close, can you just repeat some of those numbers again? I'm sure people have been listening, may wanted to make a note of them. So,
Okay, so DV Connect will assist you to find emergency accommodation. Their number is 1800 811 811. Then we have 1800 Respect. This is more of a long-term telephone service that will help you with ongoing planning. Men can also call 1800 Respect to get support on what they may need to do. And so it's information and referral, but also planning and working towards achieving safety. So that's
both of those services are free?
Both of those services are free. So I'll just 1800 Respect is 1800 737 732. And we offer an information referral service as well as recovery counselling for women who are safe and stable at Women's Health Queensland. And that number is
1800 017 676. That's 1800 017 676.